Meet Mr. J. He is a 32-year-old male presenting to the emergency department after experiencing episodes of severe persistent headaches with chest palpitations that have been increasing within the past 6 months. Mr. J states that he feels anxious all the time and feels as though his heart is racing even while at rest. He also states he feels tired all the time, which prevents him from going out and enjoying time with his girlfriend. His girlfriend also mentions that his face always appears to look flushed and he sweats profusely. Mr. J states that his episodes come and go and usually disappear within a few hours. Mr. J has a past medical history of hypertension, but he states he has never taken any medications for it. When assessed in the emergency department, the patient's blood pressure was 160/100. Mr. J was attached to a cardiac monitor which showed a tachydysrhythmia of 130 beats per minute. The patient's blood work showed elevations in cholesterol, triglyceride, and glucose levels. The doctor told Mr. J he needed to manage his hypertension, so he was sent home with diltiazem and digoxin for his atrial dysrhythmias. 3 months later, Mr. J was admitted to the emergency department with a hypertensive emergency. He says his episodes were getting worse and occurred more frequently despite taking his prescribed medications. The nurse did a focus assessment and took his vital signs. Mr. J's blood pressure was 198/136, respirations at 24 breaths per minute, temperature at 99 degrees Fahrenheit, pulse rate at 110 beats per minute, O2 saturation at 92% room air, and Mr. J rated his pain at a level 3 out of 10. Diagnostic tests were completed. A 24-hour urine sample revealed elevated catecholamine levels. A catecholamine blood test was then taken, which showed his epinephrine levels at 200 picograms per milliliter, norepinephrine at 2,500 picograms per milliliter, and dopamine at 100 picograms per milliliter. An MRI showed a tumor on the medulla of Mr. J's right adrenal gland. The doctor came to talk to Mr. J and explained that he has Pheochromocytoma, and that the primary treatment is to remove the tumor. Mr. J agreed to the surgery but said, "I'm nervous because I've never had surgery before." Mr. J is now asking for more information about pheochromocytoma.